This is the Big Ideas Theater at AARC. I'm Ed Highland, and we're talking about battling burnout in respiratory care. Andrew Miller is our guest. Thank you so much for coming by and joining us.
Okay, thanks for having me.
First, I guess everybody talks about it, but what's the definition of burnout?
Yeah, so the classic definition has three pillars. So you have emotional exhaustion, depersonalization, and inefficacy. So inefficacy is kind of loss of sense of accomplishment at your job. Then depersonalization is exactly what it means. You start to see the patients and your colleagues as objects and not people. Then emotional exhaustion is just literally what it says. You just don't have any compassion left, and it's really hard to kind of raise up your positive emotions. And that's how the classic literature just defines it. The Duke Safety Center defines it a little bit differently. They just call it's an impaired ability to experience positive emotion. So that's a much simpler kind of useful definition as opposed to the textbook.
And this is going to have obviously effect on not only yourself, but those around you and the patients.
Yep, so one of the tenets of burnout is that it can be contagious. So like you have one person that's burnout and it can easily spread to the rest of the staff. So there tends to be one of the strongest predictors when they do these very large centers studies with all kinds of healthcare providers. One of the biggest predictors is actually the burnout climate that you're in is the strongest predictor of whether or not people get burned out. And they're also highly associated with teamwork. So like if you have good teamwork, you're less likely to be burned out. If you have poor teamwork, you're more likely to be burned out. And those things kind of go together. And they're not quite sure the chicken or the egg, what's the causative factor there, but they go together pretty strongly.
Now, what are some of the strategies to try and overcome or get out of this rut?
Yeah, so there's quite a few strategies you can do. You can look them up at the Duke Safety Center's website. But I can talk about a couple really simple ones. The one that people usually do first is called 3 good things. So at the end of your shift or at the end of your day, you just get a piece of paper and you write down 3 good things that happened. It doesn't have to be anything big or important. It can be very simple, like I enjoyed having lunch with a colleague, something that happened with a patient. In your personal life, you got to go outside and the sun was shining. Those are the types of little things that we tend not to appreciate. And when you're burned out, or even if you're depressed, it's harder to notice these kind of positive things that happen all around us every day. And so the 3 good things over time, so you do this 3 good things every day for 2 to 3 weeks. And what happens is when you first start and you're burned out, it's hard to notice things, and it gets easier and easier and easier. And then over time, you start to notice more positive things. You start looking for positive things in your environment, as opposed to just kind of reacting to what's happening.
The teams, respiratory care teams, are usually quite tight. Everybody knows and works together so closely in there. How important is it for someone on the team to recognize that perhaps another team member is having some issues, even when that person may not recognize the fact that they're starting to slide downhill?
Yeah, so I think that's a great question. So one of the things that they teach us as part of the Resilience Ambassador course is people have a very hard time with self-awareness. So your people that are burned out, they probably don't know that they're burned out. And the things that you have to do is you can't just come up to them and say, you're burned out, do this activity, right? Because that's not gonna help. But educating the staff on what burnout means and some of the things that you can do, but also consistently trying to do kind of morale building activities, not necessarily the burnout resilience activities, but team building activities, positive activities, those types of things can really help. But the biggest thing is if you educate the staff on what burnout looks like, because you may have somebody who was really working hard and doing all these things, and then suddenly they're not so engaged in their work, and that's kind of a change in what's happening, and they may need some help. And it may not be burnout. There's lots of life stressors that kind of present the same way, so it's kind of difficult sometimes to tease out, if somebody just has a lot of problems in their personal life versus they have, burnout from work.
So this puts a lot of pressure, I would guess, on the team leader to really not only solicit, if you will, input from the employees about themselves and perhaps what they have seen among other teammates as well.
Yeah, so it's really incumbent on the leaders to develop those relationships with people so that you can recognize when things change, but also be willing to accept that burnout is a reality and put the pieces in place that can help people. So like our center has employee assistance programs, we have some physician resources, plus the individual activities that you can do as a department or a team. And I think it's really important that managers remember that they're not just in charge of like the employee, they're also in charge of the person and the person's well-being, which I think is something in respiratory care, we're a highly technical field, and sometimes the mental well-being or psychological well-being of the staff becomes kind of a secondary concern versus making sure we take care of the patient and get all of our clinical competencies done. So I think it's something that we need to hopefully can even work into schools and kind of teach people some of these resilience skills before they even get into the field, because it can be a very emotionally challenging field. You know, you deal with a lot of tragedies and end-of-life care, and it can be, you know, very stressful on people, especially younger staff who've never experienced that in their personal life or are experiencing it in the hospital for this first time. And if they don't have good emotional support, it can lead to not only burnout, but some of these people just leave the profession completely.
Yeah, you got to be prepared.
And we don't have data on RTs, but nurses, I think the turnover is like 5 to 10%, and their first year of nursing don't stay on as nurses long term.
The subject of burnout, very important topic. Thanks so much for coming by and sharing with us.
I was happy to help.
This is the Big Ideas Theater at AARC. I'm Ed Highland.